Hey, greetings to everyone. It's so wonderful to see so many of you here for this research committee sponsored satellite session on the topic of rising mistrust of public health institutions. My name is Melissa Salm. I'm a medical anthropologist and a postdoctoral fellow at Stanford University, as well as a member of the CUGH Trainee Advisory Committee and a leader of the CUGH Research Committee's working group on addressing mistrust and skepticism towards science. On behalf of my colleagues in the research committee, I'd like to thank you all for being here today. So this satellite session brings together a group of international and cross-disciplinary expert speakers to discuss the problem of public mistrust of social and political institutions, particularly in relation to global health issues like vaccine hesitancy, perceptions of science and the authority granted to scientific expertise, in recommending preventative practices and policy directions, the spread of health-related misinformation, and the proliferation of social media-driven conspiracy theories. Our objective for today is to take a critical look at these somewhat disparate phenomena through the lens of trust, and to consider with open-mindedness and an appreciation for nuance, what are the reasons or the drivers behind rising trends of mistrust of institutions that promote global health? What kinds of relationships do we as members of the global health community currently have with the public whose health we aim to serve? And what institutional changes need to be made to rebuild trust where it has been lost and to maintain trust among those who have not lost it yet? First, I would like to provide a brief overview of our agenda for the day. Next slide, please. So we will begin with a moderated discussion on trust and vaccine hesitancy. And our invited speakers' names are provided on this slide. This will be followed by a breakout session during which you in the audience will be placed into smaller rooms and have an opportunity to discuss and to react to the preceding dialogues, as well as to raise additional questions. You're welcome to use the chat function, but we also have an external website where we can take notes collaboratively and raise questions there. And we would encourage you to use this platform because it will transcend this event itself. It won't be deleted once this event is over. We will reconvene after the first breakout session into a larger group to highlight insights and anecdotes from some of these breakout rooms. Then we'll take a 10-minute break, after which we'll resume with our second session, our moderated discussion for today on the topic of perceptions of science. This will be followed by another breakout session, a reconvening into a larger group, and then some final remarks. I would like to note that this satellite session continues again tomorrow. Next slide, please. So we will be meeting again tomorrow at the same time and using the same format, but we'll be introducing a series of 2 additional dialogues on the topics of COVID-19 related information and institutions, as well as on conspiracy and controversy. To attend tomorrow's event, please register for day 2 of the session on the CUGH website if you haven't already. And on a final note, before we get started, I just want to emphasize that this 2-day event has been organized to facilitate ongoing conversations about a problem that everyone here in some shape or form perceives as troublesome. Our premise is that there remains much to be learned. There remains much to learn about how to think about this problem and how to make sense of it before we can begin to figure out what to do about it. I'm really excited to hand the microphone over to my colleagues here today, Marco De Luca and later Janelle Jett, who are our moderators for today. And also in the spirit of ongoing conversation, these 2 were also our invited panelists at last year's research committee sponsored conference session on the same topic. So on that note, Marco, over to you. You can stop sharing the screen. Thank you, Julia.
All right. Hello, everyone. This is the first session for the 2023 Rising Mistrust in Public Health. I am Marco Dell'Oca. I am a PhD candidate in Science and Technology Studies at UC Davis. I am currently writing my dissertation in ethnography of vaccine hesitance across multiple locations between Europe and the US. The invited speakers for this first panel are Maya Goldenberg, who is a philosopher of science and medicine at the University of Guelph. Her research is focused on health and healthcare, and in it she investigates and assesses the assumptions and values that shape both professional and public narratives about health. She authored a recent book titled Vaccine Hesitancy, Public Trust, Expertise, and the War on Science. Then we have John Roozenbeek, who's a postdoctoral fellow at the Department of Psychology at the University of Cambridge. His research is broadly about misinformation, polarization, and extremism, as well as how social identities change during intergroup conflict. And then we have Charles Wiysonge, who's the director of Cochrane South Africa at the South African Medical Research Council and honorary professor of epidemiology and biostatistics at the University of Cape Town, as well as professor of global health at Stellenbosch University. For more than a decade, Charles has done research on immunizations in the African continent, and more recently has focused on COVID-19 vaccination campaigns in South Africa. Just a brief note for the audience. You're welcome to pose questions, both in the chat and in the link that Mel shared. We will do your best to weave them into the discussion. Be mindful, listen to your speakers attentively, and think with them. To begin, I want to ask all of our three speakers a very general question, which will help us to better frame the way you are thinking about this issue. Please try to answer this first preliminary question in as concise a manner as you can, just a sentence or a few keywords to localize the way you're thinking. The question that I have for you is this. If one were to ask you a definition of what counts, what is vaccine hesitancy, what would you give? What are its main causes? Again, think of specific research relevant questions. And maybe we can start with Maya.
Oh, okay. So you don't want a definition of vaccine hesitancy. You want the causes of it?
Try with the definition first and use some keywords that maybe hint at causes if you prefer.
Okay, thanks. I define vaccine hesitancy as an attitude of ambivalence towards vaccines or vaccination. So it's an attitude, not the behavior being vaccine refusal. I locate vaccine hesitancy in poor public trust in public institutions. And when I think about what I mean by public institutions, or what I mean by mistrust of public institutions, I think of public institutions as the framework or the scaffolding that organizes society. And because of that, when they somehow are perceived as lacking legitimacy in the eyes of the public, the consequences are dire. We're not able to organize social programs, whether that's vaccination or getting people to pay their taxes, when there is this perception that the institutions tasked with keeping us safe and keeping us well are not working in our interest.
Fantastic, thank you. John?
Thank you, Marco. Yes, I certainly think the definition is great, so I don't have anything to add to that. I also think that a lot of the problem sort of stems from distrust, but what I would add on top of what Maya said about distrust in public institutions is distrust also in sort of less than formal or non-governmental institutions, such as media outlets, mainstream media, and so on, as well as corporate structures, such as in this case, relevantly pharmaceutical corporations. Thank you.
Great, thank you. And Charles?
Yes, I think I would also agree with the definition. As you would probably be aware, work within the context of the World Health Organization recently defined vaccine hesitancy more like what Maya has defined, and calling it a motivational state of being opposed to or conflicted about or opposed to vaccination, which distinguishes it from the previous definition, which situated it as a behavior in terms of refusal or delay. We recently did a systematic review of qualitative studies conducted in Africa to look at what the views and practices of parents are regarding childhood vaccination. And I think there we could, if you look at what the themes that came up, we could see what some of the causes of vaccine hesitancy might be in Africa. And we came up with 5 themes. There were things like issues related to social communities and networks, trust more generally, and this is related to political events, relationships, and processes, and also lack of information, also within the context of Africa, also seem to play a role. And then there are various complex interactions between access, supply, and demand of vaccination services. So those are some of the issues that we are finding around here that lead to vaccine hesitancy.
Great, thank you so much. As we can see already from these 3 preliminary answers that we got, the question of trust comes out powerfully whenever we think about this, which kind of leads me to the next question that I have. And if you can answer this more diffusely. Now, what I want to think about with you is this, because one way or another, you are all scholars that have worked on vaccine hesitancy on this theme, and I'm sure you're familiar with this tension, so to say. What I mean by this is that one could characterize research in vaccine hesitancy within more or less 2 spheres. On the one hand, you have it's a representation of this issue, which focuses on how people misunderstand the science, how people are not really well equipped with good tools to make sense of what is true and what is not, and they're victims of misinformation with not much to do about it from themselves. On the other side, some other scholars focus on vaccine hesitancy, as you said, as a problem of trust. People do understand the science, but they do not trust the institutions behind it. If you buy into this distinction, how would you position yourself in it, and why? And we can follow the same order unless someone wants to go first.
I don't object to keeping the same order. So
Okay.
I position myself on the mistrust side. I see misinformation as surely part of it. I mean, we have to think of all the influences that shape people's healthcare decision-making, and misinformation and certainly disinformation is part of it. But when I look at the now growing, even swelling misinformation research enterprise, I worry that there's too much focus on the misinformation itself and not on the causes that prompt people to find conspiracy theories or misinformation believable. So I think it takes a person who is sort of feels unsupported by the system, feels like the system, the structures and the systems don't work for them, that hear these kinds of views about about government conspiracy and corporate greed, and they find it very believable because it fits with their experiences in the world. So I put myself on mistrust, but it's not to marginalize. It's not to say that misinformation isn't a part of it. Social media, misinformation, echo chambers fit into the influences on everybody's healthcare decision-making.
Awesome. I think that your comment pairs very interestingly with what I think John could respond.
Hi, sorry, I dropped out for like 20 seconds or something. If I didn't hear your complete answer, my apologies if I repeat what you said. I would position myself somewhere in the middle in the sense that I think that distrust is something that the producers of mis and disinformation tap into. And if they are really good at this, they tap into it really well. And that is to say, I think there is a large degree of legitimate distrust. For instance, if you are from the United States, let's say from Appalachia, and you are a victim of the opioid crisis in the sense that Purdue Pharma has made your family addicted to opioids and has just paid a relatively minuscule fine for that, right? That happened. For the, let's say the same pharmaceutical company, or at least a very similar one, to then step in and say, actually, we have COVID now, we think you should take the vaccine. And for someone to respond to that request with distrust, I think is reasonable, right? However, what I also think is the case is that sometimes you can fuel distrust and exacerbate it to unmovable levels. And so that is what you tend to see when it comes to misinformation that we see online. Oftentimes, people do make sort of false claims or sort of express sort of misunderstandings of science, but also in some cases there is much more of a deliberate component to it, in the sense that you deliberately zoom in on individual cases of vaccine injury, ignoring, for instance, how often that happens, right? Et cetera, with a particular goal in mind. For instance, there's a lot of people such as David Avocado Wolf is a very famous one, but there's others too, whose business model in part depends on fueling distrust in vaccines and other medical procedures and treatments. Then there's political actors, right? We know, for instance, that a substantial component of the bots that we saw on Twitter who were spreading COVID-19 misinformation were sponsored by unnamed governments, right? And so there's a two-way dynamic going on between partially sort of legitimate or at least understandable distrust and the less, I would say, legitimate or less understandable production of content that taps into this distrust with particular goals in mind. Thank you.
Awesome, thank you. And Charles?
I think there is a lot of, we agree very much on these issues. I think there's a lot of homogeneity in what we all think. And I wanted to just bring you, I could go also through some of our research, and I saw Rana put a link to the paper that I alluded to a bit earlier here. And just to situate that, you know, when you look at the behavioral and social drivers of vaccination framework that various groups, including the WHO, has been involved with to produce, I was also part of that. When they put various as this framework, there are various domains. They put thinking on the one side, thinking and feeling, which will lead to things like vaccine confidence, and it includes perceived benefit, safety, and trust of vaccination. Then there are issues related to social processes, thinking about social norms and all of that, which might all influence what they call motivation, which is where they situate vaccine hesitancy. And of course, with all of this now, the influence that they might have, and also additional influences that might come from practical issues, then they might influence behavior. But talking about trust, what we have found in this systematic review that was put there that I talked about was, in terms of trust, we identify about 4 categories, where we find from some of the studies in Africa that there are areas where there is generalized decline in trust of authority and expert systems for various reasons, where people generally don't just trust. And there are examples from northern Nigeria for the polio, but also in other parts of Africa. Then some of the studies that we have found also look at issues around agendas, interests underpinning the expert systems implicated in the vaccination system, where because of various sociopolitical issues, people think that there are various agendas that the healthcare system and people involved with vaccination might have. And a few other, and there have been also past controversies that have happened, some of the things that have happened, which people, of course, they try to find a link between that to show why they don't trust the system. So essentially, I agree with what have been said, but just saying that to a certain extent, it's not kind of either or, depending on the situation and context do differ, even in areas where you think things might be homogeneous, like Africa, one issue might be more important than the other to various people.
Wow, this is really great. A lot to say. Let's try to, I'm going to try to keep it organized. First thing first, I want to reflect a little bit about how these developments reflect on other definitions of vaccine hesitancy we've been working with. What I'm thinking about in particular is the WHO definition that focuses on context specificity and relevance to specific vaccines. And in this perspective, this is a very international panel. We have a speaker from Canada, one from the UK, and one from South Africa. And beginning with this perspective that we all seem to share, we can maybe try to see if some differences develop in the way the articulation between trust and misinformation, or mistrust and misinformation, play out in different places. Can you see particular differences, for example, Charles, between what you've experienced or seen in a European or US context versus South Africa?
Yeah, I know there might be some generalities, of course, that one can see general trends across, whether in Africa or, because being the kind of world where we are now, where things spread very rapidly through social media and all of those. So some of the issues that start in the US are rapidly picked up in South Africa or in Europe. So there are general trends around that. But there also tend to be some specific issues that might be relevant to Africa, for example, where because of various issues and various controversies that have happened in the past, people might link, for example, vaccination. I mean, it might be a small minority, but if they are vocal and expressed through social media and the rest, others might tend to believe it, where some people, for example, think that some of these things are to reduce the African population, to depopulate Africa, for example. So issues like that might be relevant to one area, more relevant to one area or the other. But with social media now, most of the things that are being discussed or coming up in the US, in Europe, they easily get picked up here.
I think this is super important, and I want to hear John's take on this. But just as a side note, I think that what Chart just said puts an interesting kind of pressure that brings us to rethink, or pushes us to rethink, the definition of vaccine hesitancy that the WHO gives, because context relevance is, of course, still important, but not anymore as central as we used to think it was, because there is all this interconnectivity. What do you think, John?
It's really difficult for me to speak about the context in South Africa because I have never visited.
No, of course, but in relation to the UK.
Yes. Here, I think, just to give an example, one of the things that I think the UK government did quite well when it comes to the vaccination programs in the United Kingdom was the Johnson government at the time enlisted local leaders basically into the vaccination programs. So for instance, you could get a vaccine at a mosque at a temple. And that, I thought at the time, was extremely clever, because for all its faults, and many governments have them, the government seemed to realize that they don't enjoy a lot of trust in certain communities, and oftentimes for good reason. Right? And so they said, well, maybe we're just not the right messengers here. Maybe the central government isn't the right entity to be seen to be completely in charge and administering the vaccines and so on, right? But if we can get the help of local leaders who want to help us out and sort of set up a vaccination clinic in a building that a lot of people visit, right, in this community itself, that might actually sort of overcome that barrier to a certain extent. And to be honest, I don't actually know if that had any measurable impact on vaccination rates, because that is extremely difficult to know. And I won't speak to that because it will be irresponsible. But at the very least, it's a good idea, and perhaps something that we could learn from sort of worldwide moving forward.
That's great, and kind of leads you to a point that I think ties this together somehow philosophically, Maya. That is to say, and it's also something that I'm seeing came up in the audience questions. As John just said, governments had to turn to other forms of management to approximate, to bring people closer to the necessity of being immunized in relation to COVID. Do you have anything to say as to why is it that this tension between people and government and trust becomes so apparent and so evident today? And also, in this perspective, does philosophically or bioethically imposition of vaccination constitute a problem in relation to freedom of choice?
Those are a good, interesting set of questions. So there's already a legal history about vaccination, especially vaccine mandates, and it's the general agreement is that even mandated vaccination is legally and ethically acceptable if the situation is dire enough. And we're always trying, when we introduce public health measures, we're trying to minimize the infringement on individual liberty. So it needs to be justified by the emergency situation, and the imposition needs to be as minimal as much as possible. Now, that is probably still the case, but it is hard to ignore that what is perceived as imposition on the publics is growing over time. And I actually relate that to mistrust. People, vaccination is often folded into all kinds of political agendas. So we can never think of vaccines as separate from the politics and the circumstance around there. And I'd say over less than 10 years, vaccination, discontent about vaccination has been moved to the political right as a problem of freedom in a way that it wasn't there before. I can honestly tell you that when I started researching vaccine hesitancy, this was pediatric vaccine hesitancy, I started in Canada, but it sort of grew to include other high-income countries. Vaccination was not a partisan issue. There was opposition on the left and on the right for different reasons. And I watched how it got shifted to the right starting around 2015. I can actually point to political moments where it seemed to go. And now we associate vaccine hesitancy with sort of right-wing populism. So the question of freedom got repackaged such that vaccinating in order to contribute to a social effort to protect the public was seen as an infringement. And that gets back to the question of how much of an imposition is requiring your population to vaccinate. And the imposition is seen as higher now than it was before.
Which of course results in higher degrees of resistance among the right, of course.
Yes, yeah.
Charles, do you see this political polarization in South Africa as well?
Yes, well, maybe not to the extent that you see in the West or other parts, but of course there is. But one other thing that we've seen in terms of why the mistrust in the systems is also issues of marginalization and social exclusion. As you would know, with us, South Africa is probably the most unequal society on earth, probably for various reasons. And also some people find that there are, if the mistrust institution implicated in vaccination and the government, because they think that probably there are some misalignment of priorities. There might be communities for which there are various other issues for which have been neglected in their communities, which they consider as priorities. And if governments are not coming in to the party for those issues, and they're only coming for vaccination, then they start questioning what the intentions are. If it was for their good, why prioritize one thing over the other? So when there are cases of marginalization and social exclusion, people tend to mistrust the government and institutions involved with vaccination.
This is an amazing point, really. Thank you for saying that. I think that this problem, I mean, in your formulation is relevant to your context, but I think that for all of us that do research on vaccine hesitancy in the West, this issue, namely the fact that the government manifests itself in its interest to public health only in relation to vaccination, becomes really, really powerful, is becoming really more and more powerful. And in this perspective, I think you are also covering one of the questions that I'm seeing coming up from the audience. I can read it to you, Charles. Somebody says, I'm confused. Wouldn't one expect greater acceptance of vaccination in Africa since vaccination programs are highly propagated? How would you respond?
Yes, vaccinations, well, make no mistake, vaccinations they are the most successful public vaccination program is the most successful public health program in Africa, and I'm sure in other parts of the world. But that does not mean that everybody comes to the party. So there are still pockets of the resistance of people conflicted and opposed to vaccination. But these are still pockets, but if they are not managed well, maybe they could increase. And then, of course, you know, for some diseases, you need to have very high vaccination coverage, like for measles, to be able to have herd immunity. So we need to get the coverage as high as possible. So even these small pockets of resistance, of hesitant people, they are important when you put that into that context. But overall, people accept vaccination in most places in Africa.
Awesome. And now I think maybe we can return to the main tracks of the conversations that we started with the first rounds of questions, namely the one on the distinction or tension that you seem to live in relation to trust or mistrust and information and misinformation. Because I want to turn to the way this kind of reflection can inform global health efforts moving forward. In particular, we're understanding that there is at least some distinction, some communication, some overlap, but for sure some distinction between mistrust and misinformation. What difference do you think it makes moving forward for global health efforts to think this problem in these terms? Namely, or in other words, how would privileging misinformation versus mistrust change the efforts we make in order to approach this problem? And I don't know if somebody wants to go first. John, you didn't speak the last round. Maybe you can go.
Sure. So I think certainly like one doesn't rule out the other, obviously. So when it comes to building or like sort of reducing mistrust, I suppose, there isn't really any hacky way to do that, really, as if you're a government or a public health institution or the WHO or something like that. And so what tends to happen is if people find legitimate reasons not to trust you, they will continue not to trust you for a very long time. And it takes ages to rebuild that. In Dutch, Holland is where I'm from. In Holland, we have a saying which goes, trust, what is it again? Arrives on foot and leaves on horseback. That's it. So it takes ages to build and rebuild. And so the only thing you can really do is be trustworthy, right? And so if we're talking about things like designing whatever psychological interventions to, I don't know, build trust, reduce vaccine hesitancy, whatever those might be, the kind of stuff that I'm often asked to do. Well, there's only so much I can do to help you if the people have legitimate reasons not to trust you, right? And so there's that. Don't be corrupt, I guess, would be a good start. Well, that isn't always equally easy to do, depending on where you live. And then when it comes to countering vaccine hesitancy, there are sort of studies that have been done that are shown to sort of significantly reduce people's level of vaccine hesitancy, which I think Maya correctly pointed out is an attitude, not a behavior. whether anything has been done to actually successfully increase vaccine uptake is a different story, right? That is extremely difficult to even measure, so I won't go down that path. But as far as sort of focusing specifically not on mistrust, on countering vaccine hesitancy because you want to reduce, let's say, false beliefs in the vaccine, there are many things that you can do that relate from literacy programs all the way towards debunking efforts and so on, which are effective, even if it remains not that well known how effective they are at scale and when implemented in the field and for how long. It's more difficult to know.
Fantastic. I would no, first, does it anyone else of you, Maya or Charles, want to comment on that? Otherwise, I have another question that I can continue.
I'd like to comment that to shift from to shift away, as you originally asked, from sort of people that don't understand the science or maybe misinformed towards mistrust requires stepping back a little bit and looking at the causes, the sometimes the quite far causes of mistrust. I often refer back to the economic development literature that talks about trust and says people trust institutions, government institutions, for example, and even non-government institutions, if they feel that their government is giving them some kind of economic security and their government is perceived as truthful, as in not corrupt. So if you think the system is broken, any kind of information campaign, especially coming from that broken system, isn't going to be very convincing. So when you talk about trust and vaccine hesitancy, I would point us towards things like the social determinants of health. Luckily, health can be defined very broadly to include, access to enough money to live, safe housing. And it's in that context that a vaccination program becomes believable as a good effort by the government to continue your health and well-being.
Fantastic. I have a question for you, John, because I was thinking, and this is not literature I'm familiar with, is there a solidified, coherent link between this behavior that we're approaching, vaccine hesitancy, or this behavior, this thing, and misinformation? Is there an established, measured link?
Yes, but you can't read it yet because it's under review at the moment.
Okay.
Yeah, no, I mean, so we did, well, I shouldn't say we, this was led by Sahil Lumba, who is an absolutely brilliant PhD student at LSHCM London School of Health and Tropical Medicine, who we did a study with together recently, where we were lucky enough to have a survey of about 16,000 participants across the United Kingdom, distributed equally by region, more or less, represented by region, which is a very nice thing to have. And that survey included a measure of misinformation susceptibility, sort of a standardized measure of that, like a psychometrically validated scale. And so what we did was we looked at whether performance on that test, right, the misinformation susceptibility test, is correlated, controlling for other things like age, gender, what you vote for, and so on, and vaccine uptake, COVID-19 vaccine uptake. And that turned out to be the case. So that is, as far as I can tell, the finding is extremely robust. Of course, Sahil is a better mathematician than I am, so I have to take his word on it a little bit. But at the very least, it's a great study by him, where that link does seem to be established in the sense that in regions where people reported sort of or had lower or higher levels of misinformation susceptibility, meaning we're more likely to believe any random false headline, vaccine uptake was lower, generally speaking. So that is, an association, I guess you should call it, not necessarily a causal link. We could not establish, of course, if it's because people were more likely to believe misinformation that there was less vaccination. That cannot know this from the study that we designed, but nonetheless, it was, at least to our knowledge, the first study, aside from one, which is sort of slightly smaller and different in scope, that established this link with a degree of satisfaction that I'm happy with.
I have a question that kind of expands on this measuring that you just explained to us, John. Does disproportionate distribution of wealth and resources among population increase hesitancy and mistrust?
Do you mean is socioeconomic status correlated with vaccine uptake?
Yeah, that's another way of translating the concept. Yeah.
Yes, that is correlated.
That-
Whether it's causally correlated or causally related, I'm not so sure. But yes, the
So
correlation.
you can establish causation.
It's extremely difficult to establish causation in these kinds of things. Do people so the question here is, do people refuse the vaccine because they're poor? But it's very, very crudely, right?
Mhm.
That I don't know that. Like, there's no study that shows this cause, and it's almost
Okay.
impossible to know. Yeah, so I would be very careful with sort of statements like that. Is there a correlation? Yes, that's true. But correlation, as we know, does not equal causation.
Fantastic. We are beginning the final moment of this part of the event before we turn to breakout rooms. And I want to push you into thinking about moving forward. We've seen that trust has become an issue, it's become a problem that is connected to many other relevant problems. The question that I have for you is, how do we rebuild trust in science if we think with the standpoint that is lost? Do we want to rebuild it? How to maintain trust among those who have not lost it yet? And last but not the least, is it only vaccine hesitants that need to change their mind? And maybe we can go around like we did before. So Maya?
Improving trust in science is desirable. I can't see any reason that we wouldn't want to do it. And to do that, I think we need to address the reasons that some people look at science not as a force of good meant to improve our lives, but as, an institution of power, or an institution that serves the interests of power, whether that's government or corporate. That's certainly a well-known narrative in Canada, where I live. This idea that, for example, pharmaceutical companies had too much say in vaccine distribution and were influencing government to, first of all, buy them at exorbitant costs, and then to push towards mandates, even where mandates might not have been necessary. So that is an example of science and government working towards the interests of the power rather than the people. So one way to address that is a way to address mistrust is to address the things that people don't trust, and changing the relationship of scientific science, especially the big corporations like pharmaceutical company, in relation to government and the people, is certainly a good start.
Fantastic. John, if you want to comment.
Yeah, well, good points by Maya, I think, so only very minor sort of things to add. I think I'll sort of jump into the question of, should only the vaccine hesitant sort of have any incentive to change their mind? No, I don't think so. I'm a working sort of publishing scientist, if I may take the liberty of calling psychology a science. What I do notice sort of in my day-to-day work, and also in my in sort of my impression, sort of how the scientific publishing works, right? There are quite a few incentives that I don't think are necessarily conducive to publishing the greatest science possible, right? It's less the case now that I have a few publications out, but it certainly used to be the case at the beginning of my career that publishing matters, right? And publishing not anything necessarily, but getting it through peer review in itself is an important thing, right? For a young, especially scientist, but any scientist really to achieve. On top of that, there's impact to be taken into account, right? Universities love impact and love the sort of flashy findings that can be reported in newspapers and all these kinds of things. All good, right? All wonderful in principle, but it does sort of distract you from the fact, in my view, that a lot of science, especially in psychology, is incredibly messy and oftentimes not very spectacular. And oftentimes you find this sort of ho-hum and all these things, right? And on top of that, you get these economic pressures from time to time, right? For instance, when it comes to vaccine hesitancy, doing vaccine trials and all these kinds of things, they do have to work, these vaccines, right? And of course, there's a lot of science behind them, why they would, and the theory is very good and all these kinds of things. And so what you're left with is a situation where scientists, especially those who aren't particularly secure in their careers, experience pressures that are not exactly what I think they should be, which are, here's the absolute state of the art, the best stuff we could have possibly come up with, or our failures and our mess ups and everything that we tried and failed. Here it is for all to read. And I can sort of feel safe and secure in my continuation of that process because that's how science works. You fail a lot, and then sometimes you succeed, and then you build on that. And so in that sense, I do think that as an industry, I suppose, or as a field, right, science, especially that which relates to medical science and so on, can sort of take a step back and think about how we can improve that. Thank you.
Thank you so much. Thank you. And Charles?
Yes, at the risk of breaking a record, I will just say I believe with everything that has been said, I have been saying. But before COVID, one of the things we did when we looked at misinformation and disinformation, both online and offline, we found that there was a very strong association between that misinformation, disinformation, online and offline, and vaccine hesitancy, and both vaccine hesitancy and a drop in vaccination coverage over time. And if we take even during COVID, because some of the issues have been accentuated during COVID because of the sheer magnitude of the vaccination program. Within South Africa, when we look at COVID vaccine hesitancy, for example, we find that there are multiple socio-economic and political factors that are associated with vaccine hesitancy, some of which are not knowledge related or misinformation, disinformation related. And this include, among other things, the fear and uncertainty, practical challenges around access to the vaccines, like what I've mentioned before, experiences of marginalization and poverty, and even the geopolitics surrounding COVID-19 vaccination and the pandemic. And from looking at that more globally to us, we think that strategies to deal with vaccine hesitancy and of course to increase confidence in science more generally should form part of broader development and trust building measures that focus on issues of relationships, transparency, inclusion, equity, and justice. And I'm very happy to.
Oh, that's unfortunate. But so this is a good segue somehow, even though unfortunately, Charles, are you with us?
Yes, I'm here.
Oh, sorry, I think you broke off for a second. But that's great, yeah. I would keep this on as like all day long. I have so many questions for you, but time is up and we need to transition into our breakout rooms. So
now we will ask Julia with CUGH to please facilitate breakout rooms where members in the audience can be grouped in smaller groups to continue the conversation and the questions provided by our speakers. Our speakers are welcome to join these rooms as well if you like. There are many questions already in this document, in the link that we shared as well. We invite everyone now to have a more interactive dialogue to continue this. So Julia, would you mind facilitating?
Yep, everyone's going to be entering a breakout room in just a moment.
Thank you so much to our panelists for inspiring us to take a critical look at these issues. We really appreciate you being here today.
thank you. Thank you.
Thank you. Marco, can you still hear me?
I can hear you, Maya. Yeah. I was about to join a room.
Okay,
Yeah.
I'm not going to join it now. I have to get to my office hours.
No, don't worry. Thank you so much, though.
Thank you. It was really a great moderated session. I appreciate it.
Fascinating, fascinating. I'll reach out. Thank you, Maya. Have a good day.
Okay, keep in touch.
Bye-bye.
Bye.
Okay, hello everyone again. Are you able to see and hear me? Fantastic. At this point, I would like to invite some of my co-organizers to share some insights and anecdotes from the breakout sessions of which they were a part. Receiving feedback in real time that we want more time in the breakout rooms, we can definitely we can try to achieve that for the following sessions. But for now, why don't Gabriel, why don't you go ahead and perhaps share some of the things that were discussed in your breakout room?
Yeah, real quick. I mean, again, it's not a summary. We had a very interesting and rich conversation. Just two short points. One was the mention that the very relationship between the two individuals that are in this room, one with the needle and one with ready to get the vaccine, is something that should be more thematized and investigated as a one person-to-person relationship. And the other thing that I will not elaborate on this, but of course, the question of the role of social media was mentioned, and I'm sure that we will have more time to talk about this over the next few panels, the 3 panels that are to come. Thank you.
Marco? You're muted, Marco.
Sorry, I was taking notes and I lost track of if I was muted or not. I think that the biggest takeaway that came from the breakout room I was in was that probably institutional scientists are not consciously dishonest or misleading. The intention is that of not wanting to cause panic. At the same time, the shift between multiple incompatible certainties versus the admission of uncertainty was definitely something that very, very negatively affected public trust at the beginning of the pandemic. And the result is that people were not particularly inclined to accept this medication, especially because it was presented as something that was done really fast, whereas people wanted something done more slowly, or some people wanted something done more slowly, or without that same focus or intensity on fastness and velocity as it came during the vaccine production.
Great, Janelle?
So our discussion largely revolved around the sort of ideas or dichotomy between sort of political dialogues versus scientific dialogues, and how that really shifted during and following the pandemic. We talked about public health. And then we also talked about people's sort of willingness during the pandemic to violate social norms in particular. And so one of our groups shared an anecdote about a plane being deboarded because people refused to wear masks. And discuss sort of how our willingness to do those sorts of sort of public nuisance behaviors seem to be acceptable for sort of pandemic related behaviors in ways that they wouldn't otherwise be accepted in those situations.
Great, Marianne?
Yes, group 1 discussion was very interesting. It was recommending and asking to shift the the scope. It's not about trust, it's about trustworthiness, and if to reframe the vaccine hesitancy to vaccine equity, because there was a kind of and to shift it to pathways of inequity and injustice. And that was seen in many cases around the world, and some marginalized people, they were affected by the outcomes, As well, there was a kind of mismanagement of the messages given to the public. There were tremendous messages from here and there, and some messages were not reaching the public because it was in English, for example, and the population didn't know the English well. And as well, they were asked to read, and many couldn't read.
Thank you. That came up in the groups that I jumped in as well. To echo, Mariam, what you were saying, that one way to think about mistrust is as a symptom of social pathology. So while mistrust can be exacerbated by things like mixed messaging and the proliferation of all types of information vis-a-vis social media, that it begins almost earlier, that mistrust can come from basically social and political and economic marginalization and exclusion, and then be further exacerbated by things like mismessaging and the spread of misinformation. Another thing that another group talked about as potential solutions are to involve trusted figures, whether that's doctors or community leaders, in the communication with people who they are hoping to get vaccinated, but really emphasizing personal relationships with trusted figures over just formal messaging from established institutions like the government or a local, state, or national public health system. Also, someone else recommended the need, especially for people in the global health community, to really try to learn from, if not collaborate with, social scientists, people who do science and technology studies, medical anthropology, applied sociology, who study the relationships between society and science, and that incorporating some of these insights into conventional global public health research and intervention efforts might also help us to address these problems moving forward. So really celebrating a transdisciplinary approach to the problem we all seem to be collectively perceiving. Excuse me. So on that note, what we'll do now is we will move everyone into the waiting room. We will take a 10-minute break, get yourself a cup of coffee, go to the bathroom, pet your dog, whatever you want. And then we will reconvene in 10 minutes from now at 10:30 a.m. Eastern time to begin our second session with a new group of speakers talking about perceptions of science. Okay, Julia, would you mind facilitating the waiting room?
Yep, I'm going to go ahead and put everyone into the waiting room now.
Thank you.
Okay, everyone who needs to be should be in the waiting room now.
Okay, great. Please let the speakers come in. So Michael Bank Petersen, David Michaels, Arioene Vreedzaam, and Thomas Safford.
Okay, I've let in 2.
Mm-hmm.
I'm just looking through the list to see.
Mm-hmm.
I don't think I see Arioene on yet.
I see him. I'll let him in.
Oh, okay.
Okay. Hi, everyone. Good morning, good afternoon.
Hello.
How are you?
I'm all right, thank you.
Great. It's good to see you all. Thank you for arriving on time. We're on schedule actually, which is pretty phenomenal. So before we get started, I think we just wanted to make sure that we can pronounce everybody's names correctly, first and foremost. Ari, would you like to be introduced as Ari or using your full name? And I think you're muted right now.
Yeah, Ari's fine.
Okay, and you pronounce your last name Vreedzaam?
Yes.
Okay.
You could also, I mean, if you know how to say it in Dutch, Vreedzaam.
Janelle, that's up to you.
Unfortunately, I'm not that skilled, but I'll do my best to use the bastardized, anglicized version. With much apologies. Thank you.
Okay, great. Janelle, is there anything that you would like to
Well,
go?
and I'll ask for everyone else, do you prefer first names or would you prefer like Dr. Michaels, Dr. Safford?
I like David myself, but be fine with that.
I'd also say just Tom is fine.
Okay.
Yes, Michael.
Okay, great. Thank you.
And then Janelle, I don't know if you know, if you decided, I'm sure you have a range of questions for everyone. Would you like them to be able to ask questions to each other, or if they are compelled to do so?
Yeah, excuse me. And I would say, you know, similarly to the first panel, you know, feel free to, you know, signal by raising hands that you'd like to follow up, or use the little raise hand function on Zoom. I'll try to sort of give everyone a chance to answer every question right, or sort of follow up on people as you see fit, but also feel free to signal, yes, I have something to say, or yes, I'd like to follow this up right away.
Is that okay? Great. And then Michael, can we just make sure that your audio is working?
My audio?
Yes. Okay,
Yes.
Great. I think if that's what I would like to do is when we reconvene in 6 minutes, my request would be to turn off your microphones as well. You don't have to do it now, but when we reconvene, turn off your microphones and your video. That way I can just reintroduce the event. I'll do it very briefly, and then I will hand it over to Janelle. And when I do so, I would ask for the panelists at that point to turn on your videos. Okay. Great. Yeah, we just had I don't know if you were able to catch just the end of it, but we just had a really fantastic panel on trust and vaccine hesitancy. And I think that one of the major things that got communicated, which I'm really pleased, was that, you know, really thinking about trust or the lack thereof as symptomatic of social and political exclusion, not so much like a result from misinformation or mixed messaging, although obviously, you know, in large part exacerbated by that, but that also something that kind of precedes that problem. That was a really interesting message that seemed to have gotten imparted. And then because then it challenges people in the global health community, you know, to think, you know, when devising strategies for addressing it, to go beyond what some of the best practices currently are, you know, like not to neglect them, but like obviously, you know, increasing science literacy is like an important part of it, but you know, trying to understand what are the legitimate reasons for mistrust, and intervening there, in addition to some of the more tried and true strategies that we tend to hear about. So that was really interesting. So yeah, so as Janelle said, you guys are very welcome to directly to field her questions, but also if is something that has not yet been addressed that you would like to be addressed, or if one of you says something particularly compelling that you would like to know more about, or if something occurs to you, please feel free to talk to each other and make this as conversational as you would like. Janelle, do you have bios for everybody?
I do, and Ari, thank you for sending that along. I wanted to make sure I got that right. Yes, I think I have bios and introductions. Hopefully that they do you well justice. Unfortunately, I had to truncate some really impressive backgrounds, so it's really the highlights. But so thank you for forgiving me for all the wonderful things I left out of all your bios. That was probably the hardest task. So.
Yeah.
Oh, sorry. I just have one question. Like, what is the initial question you'll be asking us all?
Yeah, absolutely. So yeah, to start, I'll just ask, like super concisely, what you all think the root of public mistrust of science or scientists is. So just a real hot take, few keywords or a couple sentences, and then we'll follow up from that question and move forward.
All right, thanks.
And Janelle and I were speaking about this earlier. We titled this your session about perceptions of science, but what we noticed, and perhaps it was a bit misleading in the way we chose to title it, is that so many of you are really uniquely and importantly situated at the intersection between science and policy, in the way that science can inform policy, political decision-making and the creation of policy. So I'm sure Janelle may have some questions as well that target that, given your backgrounds and your expertise.
And I will say too, that even in the breakout room I had, there was a lot of discussion about sort of, we understand the US context. And so thinking about that across context, and I know we have lots of expertise from the US, but also a number of other countries around the world in different contexts. And so I look forward to thinking about that in part of the conversation as well, about how some of these are sort of maybe universal, but other issues around public trust are very context specific. And so hopefully we have a discussion around that as well.
So quick question was, were there any, or should I say, international perspectives in the previous session?
Yeah, and Mel, I think mostly Western Europe, or sort of Western.
We had a speaker from Canada, from the UK, from South Africa, and so that was interesting as well to kind of talk about generalities across context, but then also things that are specific to local context. And actually, and we have to conclude in 1 minute, but one thing that I think was really important that emerged from that was that the WHO has a definition of vaccine hesitancy that emphasizes the social and political situatedness of vaccine hesitancy, which is important, but also because of social media and global interconnectivities, there are things that kind of transcend context and start one place and appear other. So yeah, so we addressed it from both of those angles and invite you to do the same in your panel. Okay, Julia.
Yes.
At this point, I'm going to ask the speakers to turn off their microphones and their cameras and to invite everyone else from the waiting room back into the session so that we can begin again.
All right, I'll go ahead and admit everyone.
Thank you. Okay, welcome back, everyone, from our break, and thank you again for joining us for today for part 2 of this research committee sponsored satellite session on addressing mistrust of public health institutions. We're excited to introduce to you our second group of speakers who will be talking about the problem of public mistrust of social and political institutions, the reasons or the drivers behind rising trends of mistrust of institutions, and also incorporating some of the insights we just learned from the previous panel, continuing to ask ourselves, what makes an institution trustworthy to begin with? And what institutional changes need to be rebuilt where trust has been lost, or to maintain trust among those who have not lost it yet? So to continue on these threads while introducing new domains and perspectives, I will now hand it over to Janelle Jett and the speakers in the following session.
Yes, hello. So my name is Janelle Jett, and I'll be the moderator for the second panel today. I'm a political scientist and postdoctoral researcher at the University of Missouri in the New Carbon Economy Consortium. And in my work, I examine how politically driven communication choices interfere with public support for policy solutions, particularly in the context of science, technology, and environmental policy. Now I have the much more exciting task of introducing our impressive group of panelists for today's discussion. And we're pleased to have 4 panelists. They can speak about public perceptions of science, particularly as science intersects with policy. So first, we have David Michaels, who is an epidemiologist and professor at George Washington University. He served as Assistant Secretary of Labor for the Occupational Safety and Health Administration, OSHA, from 2009 to 2017, where he was the longest serving administrator in the agency's history. Since the pandemic began, he has focused on improving the protection of workers exposed to COVID-19, and he served on 2 National Academy of Science expert panels and is a member of the Biden-Harris Transition COVID-19 Advisory Board. As a renowned writer and public health advocate, Dr. Michaels has written on issues related to the integrity of scientific information underlying public health and environmental regulation, including how scientific arguments get used by different interest groups to undermine public health protections, corrupt the scientific record, and mislead the public. Next, we have Michael Bang Petersen, who is a political scientist and professor at Aarhus University. His research focuses on human evolutionary psychology and its role in politics, including the evolutionary foundations of political misinformation, fake news, and conspiratorial beliefs. Since 2020, he has led the award-winning HOPE project, researching how democracies reacted and coped as the COVID-19 crisis unfolded, and advising the Danish government on COVID policy and in maintaining trust and transparency with its citizens. For his work on citizen and government trust in Denmark during the pandemic, he earned the 2022 Research Communication Award from the Danish Ministry of Higher Education and Science. Next, we have Tom Safford, who is a sociologist and associate professor at the University of New Hampshire. His research focuses on understanding the social basis of environmental attitudes and beliefs, perceptions of science and scientists, and analyzing interorganizational relationships among public and private sector actors engaged in environmental management. He has conducted applied sociological research to support policymaking with a broad set of organizations, including the United States Agency for International Development, the National Oceanic and Atmospheric Administration, and the National Congress of American Indians. And then finally, we have Vreedzaam, who is a biological anthropologist and PhD candidate at Anton the University of Suriname, and also supported by the Caribbean Consortium for Research in Environmental and Occupational Health. He works studying the origins of mercury in the environment and the public health risks associated with that, particularly for Indigenous and tribal communities. And based on that research, he works with Indigenous organizations and public health education and awareness, but from an Indigenous perspective, taking into account cultural sensitivity and language barriers. So with that, I would, before we begin, like to encourage the audience to post questions in the chat. I'll do my best to sort of incorporate them with the discussion as we go along. And I'd also encourage you to use the link to the external platform for note-taking and question raising, which you can use throughout the session. With that, so to warm up and sort of give a frame to our discussion today, I would like to ask each panelist to respond to a sort of startup question super concisely, so in a sentence or a few keywords. And we'll start with the question, what is from your perspective, at the root of public mistrust of science or scientists? And we'll start with David Michaels.
Thanks, Janelle, and thanks for inviting me. I think we have to think about root causes, not only one root, but many. And certainly the area that I'm focused on is what we sometimes call the tobacco model, this idea that it's become standard operating procedure for corporations and others whose products or activities are alleged to cause harm to hire scientists to lie. And then it confuses the public. Journalists sort of are into both siderism, so they will say, well, one scientist says this, another scientist say that. So people throw their hands up and they say, well, we can't trust anybody.
Yeah, Tom?
Sure. Thanks, Janelle. So I was going to start with just a little bit of background. So what I was going to have everyone want to focus on is this idea of trustworthiness. What is it that leads people to be more likely to trust an individual, trust a scientist, a medical professional, and things like that? And there is a lot of good social science research on that. And I to summarize that, I think there are kind of four terms I wanted us to be thinking about. One of it is competence. So certainly the scientific community often focuses on the competence, illustrating their competence as a way to generate trustworthiness. However, research shows there are all these other kind of social, kind of more softer kinds of things that affect how people determine trustworthiness. Other ones are benevolence, like, is this person a kind person? Do I believe that they're looking out for my best interests? Openness is another one. A lot of distrust comes from this sense of science is not open. How are they collecting data? Who's funding it? Who's the organization? And then the last one that I focus on in my research is this idea of integrity. Is there integrity in the way that scientists conduct their practice? Are they people that we can trust? Are they ethical people in the way that they practice their trade? And so I'd say focusing on those four elements is really important in terms of understanding sort of the core issues that we're talking about.
Wonderful. And let's move on to Ari.
Thank you, Janelle. Two things I just want to leave here. One is communication. For me, especially, I think communication is a critical component in distrust. How do we convey information? Is it culturally sensitive? And as you know from my work, working with Indigenous people, what's the translation in their language? Usually there's a huge gap in interpreting the scientific information into a local language. And second is emotions related to historical research. So especially in the region, in Amazon, there have been many research done on Indigenous people without informed consent. So I think that's also one of the key things that leads to mistrusting scientists or even doctors. Yeah, so I'll leave it at that. Thank you.
Wonderful. And finally, Michael.
Yes, thank you very much, Janelle. So I think that there are two big factors, one that we as scientists have control over and one that we do not have control over. The one that we have control over is the degree of transparency in how we communicate with the public. What we do not have control over is that scientists are often viewed as part of the political system, which means that whatever generates distrust in the larger political system or the elite within a society, that will also generate distrust in scientists. Thank you.
Wonderful. And sort of using those sort of core roots as a starting point, let's first, I really was interested in, Tom, what you had to say about sort of reframing a little bit from distrust to trust. So I'll ask you first. So I think there's the question of sort of why should the public trust scientists or science? And then following that, what are some of the consequences then of public distrust in science and scientists?
Okay, that's a big question. So I agree. I do think I'm trying to reframe it to think about trustworthiness and that we're trying to look at the determinants of distrust and maybe kind of turn that around. I do think that there's, in the public health realm, since that's a lot of the focus here, if you think about in COVID or other pandemics, there is this sense of there's an imminent risk to people. And so a lot of the science communication or the medical communication around pandemics, this isn't just in COVID, but if you look back at SARS or Ebola, is the actual risk associated with it. So people think of the personal risk to themselves. So there is a need to sort of get people to listen to some extent. And if people are seeing an individual as compromised, and I think Michael's point about this embeddedness of individuals in the political system or in government is a part of that. But I also think it's important. The other thing that, again, the literature shows, and my own personal research, is that people, it's also the practice of science. So talking about how did you get this data? What is it? What are the limitations? There's been this hesitancy, I think, in the public health community in particular, to kind of get mired in the details about how data was collected, that you're going to confuse people. But I think what you're seeing is if you don't talk about that, they're going to go looking for that kind of information. And there are other sources of information that will talk about that. So it may be difficult to talk about the messiness or maybe uncertainty, which is something that is hard for the average person, whether they're here in the United States or somewhere else, to understand. But I think if you don't talk about that, then you're allowing that to be framed or talked about by others that probably maybe promoting kind of problematic ways of thinking about that piece of a particular issue.
Go ahead, David.
Yeah, if I can add to that, also, I think there's a perception out there that science is for sale. And a lot of people, at the beginning of COVID, I thought people would say, well, this one will be able to deal with collectively because, COVID doesn't have a lobbyist. But unfortunately, this has become politicized too, and people are very much focused on sort of vested interests and conflicts of interest. And so I think setting up systems where those issues are both very transparent and also addressed. There are some good models out there around environmental health, something called the Health Effects Institute, which is up in Cambridge, which is funded by both EPA and the motor vehicle industry, which does studies on air pollution related to motor vehicles. And it's actually done in a way that you can say that the motor vehicle industry doesn't have control over it. So I think setting up structures that say, okay, who's ever doing the research has to be insulated from who's paying for the research. The tobacco model, of course, is a big one. Now we think about vaping and e-cigarettes. We don't really know the long-term effect of e-cigarettes, but you don't want Altria to be paying for that research because you know what result they want. So how do you set something up so people really feel like the science is not conflicted, is independent?
Yeah, absolutely. Michael?
Yes, thank you very much. I very much agree with the perspectives by David and Tom. I want to add that in addition to these sort of institutional structures, in order to create a view as scientists as trustworthy, there's also something in the behavior of scientists themselves that often it's actually. It sort of seems like a no-brainer. Of course, you want to act in a trustworthy way, but sometimes there are incentives that will pull you in a direction that will lead you to not act in the way that's necessarily trustworthy. And let me just give one example from the COVID-19 pandemic, where you could say that as a scientist in a public health field, then you would very, very much like to have a high vaccine acceptance. Like your basic mission is to get people to accept good vaccines, but then comes out studies where I say, well, maybe the vaccines do not have a particular good effect on blocking transmission. Maybe there are certain side effects appearing, and then you suddenly feel the dilemma, because to what extent should you begin to talk publicly about these kinds of things? Because, well, they will potentially create vaccine hesitancy, and to what extent should you talk publicly and vocally about them? And there you are as a science communicator in this, or you may feel a dilemma where you are sometimes giving in to the short-term incentives of not really disclosing actually what is the state of the science, what are the uncertainties, and what are all the bad information, but where it's like crucial to have a focus on how do we create long-term trust in scientists and act in what is the long-term trust worthy manner. But it's just to say that it's that sometimes scientists will feel the dilemma to sort of, well, hide away the unpleasant facts that science is uncovering. Thank you.
And Aria, yeah, as I say, I want to give you a chance to respond as well.
Okay, thank you. Just yeah, I would like to actually add on to what Michael said a little bit, and I was just looking at one of the questions in the chat. So one thing, at least one thing we notice in Suriname is, I guess worldwide, is how quickly the vaccine was made. Huh? And you know, in previous vaccines, it took many years for it to go through trial before it was approved. And so I think that's one of the things where the hesitancy started. But you know, by now, a lot of people know how competitive scientists are in institutions, at universities, scientists that work for the pharmaceutical companies. So for, you know, a lot of people, it did seem like, oh, it's a race to get who's the first person to get the vaccine, or first company, get it approved, almost a shortened trial period. So I think that's also one of the key issues that's actually kickstarted the whole hesitancy towards not just the vaccine, but scientists and actually the system of how it works.
That's so interesting. I'd love to play off of that and what Michael said right before in particular, though I think this really encompasses what all four of you said, and really think about this difference between long-term and short-term behaviors. And so how do you sort of see behaviors by scientists and governments during, I think particularly during crises like the pandemic, and how those influence these sort of long-term trust behaviors? And I think I'd be particularly interested in hearing about sort of those positive and negative long-term effects when we think about then the next sort of future health crisis or sort of large issue that we as a society need to deal with. So I'll open that up. Maybe Michael, if you'd like to respond first, or Ari.
Yeah, I can try. So I think one of the difficulties in a crisis situation is that science is a slow-moving enterprise. So you have a lot of uncertainty that is triggered by the onset of the crisis, and then science slowly needs to come to terms with what is happening, and therefore at least in order to maintain trust in science, then it's crucial that people have some kind of scientific literacy in knowing that the science initially will be all over the place, and there will be findings that go in one direction, there will be findings that go in another direction, until we sort of have enough insights to get some kind of coherent view. So I think one of the dangers in a crisis situation is that even if everyone is doing exactly as they should be, are communicating the uncertainty and so on, then it might just look like one big mess if there isn't this sort of underlying sense of scientific literacy in the public.
Yeah, and Ari, I'd like to know what you think. I know you talked a lot about the sort of history of science over time in your context.
Yes, thank you. Yeah, one thing I want to add to this discussion real quick is the matter of time. And I think the past almost 3 years in COVID has actually given us a sort of a window in like Micah said, regarding literacy, scientific literacy of the public. Now the public has had a couple of years now to go filter through all the social media posts, through all the hundreds, thousands of COVID vaccine articles. And I think it's sort of I don't want to say we're there yet, but it's sort of filtered itself out, kind of. And the key thing is there that I know we, even I do that sometimes. We always say, yeah, the average person wouldn't understand that. But I mean, they're still people, regardless if you're indigenous or you live in the city or in a big city. If you can read, you can basically understand what's being written. So, as scientists, and I think we've touched upon that as well, transparency, integrity, I think we just need to give ourselves time to make people aware that, if you truly are who you say you are, you're transparent, you work, you're integral in your work, you're an honest person, there's informed consent, you explain the results, no fancy, large jargon about whatever, the p-value is this, blah, blah, blah. Just try to communicate plain and simple. I think that's, to me at least, kind of the key to getting through this crossroads of, what COVID has caused in the distrust and mistrust towards scientists.
Yeah, and so a sort of follow-up. So once again, this sort of idea of time is coming back. And so I'd be really interested, since we have so much expertise in this room working with governments and thinking about maybe COVID-19 is this inflection point, or like one of many inflection points around trust in science. I'd be interested in thinking, maybe even turning our attention a little bit from the public towards policymakers. How have we seen COVID-19 acting is this inflection point for trust in science, but also for science-based decision-making in governments as well. So how has COVID changed the way we think about both those things? David, I saw you smirk.
Yeah, no, that's a really great question. And in some ways, it's exposed some of the real limits of policy making. The government can issue proclamations and guidance and recommendations that have no force of law, or they can issue regulations and standards that do have a force of law. Those take a long time to get out. Even emergency standards take a long time to get out. So one thing that we've seen in this pandemic is we probably have to change the process first to be able to issue emergency rules, because if it takes 3 months to write an emergency rule, it may be too late. The other thing, though, is there are so many aspects of the U.S. federal government that are sclerotic, and we've seen that in terms of there's a great insistence on the part of the White House, for example, that agencies have harmonized policies, and so there are lots of agencies that have an impact on public health. It's not just CDC, but obviously the Environmental Protection Agency, the Occupational Safety and Health Administration, the Transportation Department. You look at what happened in East Palestine. But when you have a system that requires harmonization, A, it's slow, and B, it can stumble. The CDC has sort of clung to, in COVID for the first couple of years of the pandemic, clung to this idea that SARS-CoV-2 was spread by droplets, which was clearly wrong. And virtually the entire scientific community saw that they were wrong, but for whatever reason, they need to hang on to that. And that was problematic. So that leads to the other discussion, which is, I think agencies have to be much more comfortable saying, this is what we think now, and it can change. And also being able to say, we were wrong. They often just want to say, here's the new, the new policy, without referencing the previous one and why it changed. I was at the Energy Department at the end of right after the Cold War, and the policy during the Cold War was to say, we never made anybody sick making nuclear weapons. And that was obviously wrong. We had hundreds of people with beryllium-related disease and silicosis, but we were wrong. And, fortunately, there was a moment of openness where I could sort of get the President Clinton to apologize and say, no, we were wrong and we did it wrong and we're going to try to get it right now. But that's always, the instinct is always not to do that. And it's unfortunate that, especially among career people who feel like if they admit they were wrong, they will be penalized or punished in some way. So we need a sort of very different mindset in government policymakers, I think.
Go ahead, Michael.
Thank you very much. So I think that there are, or I hope at least that there are a couple of lessons that policymakers have learned, and one of the things is exactly what David is touching upon, that they need to be much clearer in communicating the uncertainty that is underlying the evidence that they're basing themselves off, because that's sort of the only way in which you can, in a trustworthy manner, say, oh, we recommended this, but now we're recommending that. That is by saying, well, what was actually the original uncertainties involved? I also hope that they realize that there are certain things you can use science for, and there are certain things you cannot use science for. That often politicians would like to say, well, this is evidence-based, and of course it's very good if it's evidence-based, but sometimes it's really a political choice. So in one of the expert groups that I was participating in for the Danish government, we were sort of asked to make a detailed plan for the reopening of society after a lockdown, and we said, well, we cannot do that, because there's no scientific answer to how you want to prioritize that sector over the other sector. What we can do is to inform you about the trade-offs, but in the end, it's really a political decision. And then as a social scientist, I think that there's a third lesson that I hope they have gotten out of the pandemic, and that's the need for social science. That in a way it was almost easier inventing the vaccine than it was convincing enough people to get the vaccine, or at least it took almost just the same amount of time. And I think it will be the same for a number of other crises. Like in a sense, just as the pandemic was too important to just hand over to the health experts, so I think the climate crisis is too important to just hand to the climate scientists. We need also to integrate social science into it. Thanks.
We'll go in order and let Tom go next.
Okay. So quickly, I also wanted to kind of reframe this a little bit. So I agree that this thinking about what's the role of government and government agencies, if you're thinking in the US context of the CDC, but certainly there are parallels in other places. One of the things I think is interesting, if you look at previous eras and studies of this, is that there is this sense of, it's kind of a funky term in English called recreancy. It's basically what it is this idea of the mistrust of the competence of agencies. So, and that's something that is usually cumulative. So there's some really interesting work on, sort of health effects from a series, many oil spills that have happened in the Gulf of Mexico. And so over time, people become distrustful of the government in particular's ability to sort of inform them about the risks and what they should be doing. And I think one of the things that might be interesting to sort of rethink about that is this idea of, maybe decentralizing. So if people have this kind of long-standing distrust in the competence of government, that maybe it's better for local physicians or individuals on the ground that might have a different level of competence. And you see that in the Ohio train derailment issue. The minute that the federal government became involved, it created massive amounts of mistrust, because then it gets mired in these political things. And it might have been better for local people and physicians and individuals to be talking about those issues, because I think that there's a sense that the federal agencies involved, while scientists want to project them as being disinterested, they are scientific agencies. I think that the general public, whether it's here, I know from my experience working in Brazil, it was the same thing during the Bolsonaro administration. They don't see these government agencies as disinterested. And so if you try to project that, and that again erodes trust and erodes sense of the competence. And so I think some decentralization of this and working more with individuals that are interfacing with the public, that may raise awareness, trustworthiness, and then get things like vaccine adoption at a higher level, just as an example.
All right.
Thank you. I wish I could say, Suriname, we've been doing really great politically, but I guess it's the same as in the US. When COVID hit, basically the government actually used the science behind the COVID to enforce, obviously, the lockdowns, all kinds of rules and regulations. And every time something changed, the rules will change without actually saying, as I think David said, oh, oops, we may have been wrong in that direction. We might have to change something in our rules and regulations. And they just kept on enforcing the rules and regulations, like, people should just follow them blindly. And I think people already do not trust the government, I think in general. So that just added more fuel to the fires, so to speak. I think, I don't remember who said it, but it shouldn't just be, the environmental health specialists or the professionals advising the government. It should be an integrated field of expertise, the social scientists, I don't know who else, the economists, engineers, I know traffic, people that look at roads, because I mean, especially in Suriname when COVID hit, it sort of became a mess. I don't want to say too much of a mess, but it sort of became a mess in Suriname. And so we really would have benefited from if the government had advice from all different fields of expertise, and especially communication, because as we've learned, the government doesn't know how to communicate. They just say, hey, we have this information and this is the rules we're going to enforce. And they don't know how to effectively communicate it to the people.
Michael?
Yeah, I just wanted to follow up on Ari's point that governments are not communicating these things, and I think often it's out of fear of the public. They say, well, will the public not lose trust in us if we are admitting a mistake? But the point is that no, people are losing trust in them exactly because they're not admitting the mistakes. And if we look at the research and science communication, then it's pretty clear that disclosing uncertainty is not something that reduces trust in the communicator, but rather the opposite. So in that sense, if you act in a trustworthy manner, then yes, you do get more trust rather than the opposite.
Oh, extremely interesting. And so I think when we think about sort of complexities then of what the government has to communicate and be transparent and sort of understand these sort of complex issues, when we think about the pandemic or other crises, right, thinking about climate change in particular, because we have a lot of expertise in the room about that as well, it's not just about science or public health, it's also these other parts of society that are also affected, right? So things like economics, individual well-being, and there often seem to be at least sort of trade-offs between these competing needs. So how do we think about, if the government needs to make decisions transparently and communicate those decisions transparently, how do they balance those needs, both in the front end of like making decisions and using different types of research about all these different effects, and then also communicate why they're making decisions and using what evidence to the public? And how do they sort of balance that in sort of creating an effective crisis response? Go ahead, Michael.
Yeah, so I think it's not really about balancing these two things. So if we know what, so according to our research and the research of a number of other people, then what really matters for generating behavior change in a crisis situation is that people feel that they have some kind of feelings of empowerment, that they feel efficacious, and of course, in order to know what you need to do and how that actually helps deal with the threat, then you need to have a pretty clear communication about, well, this is what we're going to do. But you really, as a as a communicator in a crisis situation, and that's of course the reason why it's so difficult, you need to be very, very clear on what are you supposed to do, while at the same time you are absolutely transparent about the uncertainty that underlies it. Like, this is what we want you to do. This is, given the evidence, the best path forward, but there are these uncertainties, because otherwise you cannot adapt your recommendations during an unfolding crisis if you are not doing both. So it's actually not about balancing. You need to do both at the same time, and that's difficult. I completely recognize that.
David?
Yeah, no, I very much agree that, balancing sort of sets you off in the wrong direction. But I think one approach that I think has been successful in a very tough situation is having open scientific advisory committees. We've had those, for example, in the United States around reviewing the data on the efficacy and safety of the mRNA vaccines. And you get 15 or so scientists from different points of view, and in fact, in some of these community people and lay people as well, who in public discuss this and say, this is what we think, and vote. And there can be uncertainty, and there often are, where you'll say, 13 people vote one way and 2 the other, but at least the press that covers it can then communicate both the uncertainty and how the decision is made. So I think that's useful, rather than having the decision just come out as a fait accompli from the government saying, this is what we think.
So I was gonna turn the question a little bit here, because as I was hearing the discussion and partially what Ari was saying, is sort of thinking about this in sort of a global health context, since this is the conference. So I have a colleague who's from Kenya, and she studied a lot about how sort of urban slums in Nairobi were dealing with the pandemic. And one of the things that was really interesting was, number one, was that she did surveys of these people, and for the most part, they saw it as a Western disease. Like the policies that were being put in place, lockdowns, were seen as being imposed sort of by the global health community, which was really interesting. That was number one. And then the second thing is that what created resistance to kind of some of these prevention measures, and this is also in the vaccine era, was the inability of the government or the health officials to talk about other issues. So one of the things, for example, in these communities that was really affected was food security. So as people were unable to move, these communities worked on sort of informal markets to sell food and get food. And so it caused these sort of massive food security issues. And yet the government and the people from the WHO, the international community, weren't talking about these issues. And I think this is parallel to sort of my own experience also with climate change. So I have some research in the Amazon also, and I was there last summer and interviewing people. And one of the things that people say, so the global community is talking about the problems of deforestation causing climate change, and sort of, the REDD+ programs. Whereas the reality is, if you're following the news, like right now, there are massive floods and there are massive impacts of climate change on these communities themselves. And yet that isn't a part of the discourse. So they feel like there's this discourse between the scientific community talking about the causes of the problem and not sort of the consequences, which are much broader. So the consequences in COVID were much broader than just the potential that you would catch this virus, that you would die, but also you may not have food enough to feed your family in the case of Kenya. And I think it's the same way for climate change. If you're in the Amazon, you're thinking, do I farm and do these things? I'm dealing with the impacts, or do I participate in sort of this globally kind of imposed policy? So I think the scientific community needs to think more broadly about how the discourse about it and how they're thinking about whether it's a health issue or sort of the climate issue, as another example, since you were tying that in there.
Yeah, and Tom, this actually, I think, segues really nicely into a question we have in the chat, which is, what narratives should we communicate? What narrative should we communicate to the public about science itself? So in primary education, we get taught that science is neutral and apolitical, but we're also hearing that this is also a political process. So what do you wish members of the public knew about science? And do you think that would increase trust?
Is that a question for me? Like,
I'll let you start since it.
Oh, sure. Like, I
segues,
think
yeah.
that, so here's what I would say, like, and I think this is the case here in the United States, and at least my, some of my experiences in South America, although there's certainly people probably from all over the world here that know better in their context. I think one of the things that I hear, I've been to, meetings about climate or health issues, is that, so how I do science, this is my scientific college, is I can have an opinion about things, but that would never affect how I analyze data or how I think about problems, and that somehow they themselves believe that science is disinterested, but they can be interested beyond the laboratory or the modeling on their computer or whatever it might be. I think that there is immense research showing that the general public, at least here in the United States, and actually I would say in many places, doesn't think that way. They can't imagine those separations. And so I think more direct ideas that, like, yes, I know it, I have an interest and it affects the choice of the research that I'm doing, or the funding of my research affects these things. I think being more transparent, this is that openness idea. You have to show that you're open, and this idea sort of pretending, oh, science is disinterested. That's a norm that's the scientific community has. But I think the general public doesn't see that when they see someone they might see something like climate change as being political. And so when a scientist from, UCS is up there, that makes that whole institution or that individual seem interested, even though they would say, of course, that isn't affecting our actual analysis. And so this is a problem with the cultural norms that scientists themselves have about their practice that might be different than the general public. And again, I think that's certainly an American phenomena for sure, but my guess is that it transcends boundaries.
Go ahead, Ari.
Yeah, just to, I guess, continue that discussion that Tom just started. So I think, at least in our experience, it goes both ways, because we have, I guess, a fairly decent movement of citizen science in Suriname, which actually, in a sense, bridges the gap of what Tom said. Oh, there's a scientist is not interested in my situation. They do the modeling and that's it. And so I think a lot of at least the Suriname, what they get in school is a lot of the basic citizen science. Take your basic temperature, pH, whatever, water quality. But it's not just in schools, but also in communities. And I'm speaking about indigenous communities, for example. And so they themselves have educated themselves in the nuances of Western scientific thinking, because, indigenous also think scientifically, just not the way we think it is. Their scientific process may be slower and longer, more time-based. Ours is a little different. But it sort of bridges the gap, and they take it upon themselves to learn more about what's happening with the water rise in the river. Every year it's becoming higher and higher. What happens to our crops? Do we need to change the type of crop we do? Different season, so on, so on. So I just wanted to insert that as a little different way of approaching that nuance between a science being not interested, so to speak, in what happens in everyday life, versus people that take that, incorporate it into their daily lives, and kind of use that to better themselves.
Michael, go ahead.
Yes, thank you. So I think that I very much agree with what Tom is saying, that it's not a very good response to the mistrust, just to say no, you can trust us. I'm a scientist. I am not being moved by my values. So because we know that people's values do influence a lot of things. And of course, we also know that not all published studies are trustworthy. We have in the social sciences and psychology the whole replication crisis. So we know that errors can sneak into to scientific work for self-interested reasons. Often those self-interested reasons has to do with just getting published. But of course, our political views, I would say, as a political scientist, are also as elements of our interests. So I think it's what we basically need to communicate about is, well, what are the institutional structures that are in place to guard against it? Like that's what we need to focus on, rather than just demanding blind trust. Thanks.
Well, we are rapidly approaching the end of our time, though, like Marco said this morning, I would love to hear you all talk about this all day. So I'd love to give everyone the opportunity to very quickly sort of say a last word. And I think particularly thinking about, this is the second time we've had this sort of annual conversation. And what would you, if we had a follow-up again in a year's time, sort of what would you hope would be different, or what would you hope that we would understand better by then? Or what questions would we be asking about this? I'll leave it very broadly and give you a chance to sort of say a couple words. We'll go backwards from the beginning and start with Michael.
Yeah, thank you. I could have needed a little more time, so let me see what I can come up with. But I think I think one of the interesting things that is coming out of this discussion is just and also of the whole pandemic is the need to understand how to uphold trust, the trust of science in the eyes of the public, and just like this is of course already a research field in the communication of science, but I think it is really important that we invest resources into understanding how to do it. Then, of course, also resources into following through with what works. Thank you.
Thank you, and Ari.
Thank you. I'll just continue with communication because, to me, effective communication, and not just scientific communication, but all kinds of communication is, I hope, as we continue this discussion and maybe to next year's conference, I just hope to see that we realize as researchers and scientists that it's not just our field of expertise that contributes to the well-being of everyone, but it's everyone's expertise integrated together. Like we said earlier, the social scientist, the economist, the environmental health researcher. And I think hopefully at some point we realize all those components together will help not just us, but the entire community. Thank you.
And Tom?
Sure. So with the benefit of being the third person, a little time to think about it, I'm just going to home in on another topic that I think would be really important that we should think more about. And I think about it as a university professor, but I think people inside of scientific agencies should think about it as well. How are we educating young scientists or the scientists within the CDC or the WHO or any of these things? So I think that the norms and practices within the scientific community, I mean, he pointed to it, the pressure to publish and in certain kinds of journals, and how are those barriers or facilitators, again, maybe thinking of people in the global South who don't speak English, these internal things that sort of forward certain ways of thinking about science and the practice of science are embedded in our educational systems around the globe and in these agencies. And I think thinking about that, I think you need those systemic change there as well, and that will help, again, prepare people for new ways of communicating or maybe thinking about the practice of science and how they interact with the public in different ways. So that would be my sort of charge for the future, to add that dimension to our discussion.
And David, you get the last word.
Yeah, I would add to all of these really excellent comments. I would hope that a year from now, there are resources devoted both globally and nationally to developing systems for to interpret scientific evidence. I think we have fabulous systems to create it, but it's conflicted and science has become contested terrain. So we can have systems where we involve both scientists and non-scientists to interpret and understand, interpret, and communicate the results of those science in a way that's transparent and independent. I think we'd be moving forward really in important ways.
Wonderful. I want to once again thank our panelists for this remarkable discussion. I wish it was twice as long, if not longer than it was. But with that, I will turn it back over to Mel, and I hope that we can have equally wonderful breakout rooms.
Yes, thank you. Just to echo Janelle, thank you so much to our guests. This was a fantastic conversation, so much to think about. And we invite those in the audience to continue thinking about it, to pick up some of the threads that were introduced here in the breakout rooms. Julia, if you wouldn't mind at this time facilitating the breakout rooms, following a recommendation from an audience member, we're going to add an additional 5 minutes to these breakout rooms. So instead of 20 minutes, we'll have 25 minutes now for the breakout rooms, where we can all continue the conversations and raise additional questions and talk amongst ourselves. Our panelists are welcome to join if you like, but we will do that for 25 minutes and then reconvene before closing out the event for today.
Thank you.
Thank you so much. I think at this point we are waiting for others from the other breakout room to join us. Julia, could you on your end make sure that the other breakout room is closed so that others can rejoin us?
Yes, it is closing, so they should be joining back into the room in a couple seconds.
Okay, great. As we reconvene into this larger room, I just want to take a few minutes for some of our organizers in the breakout rooms to share some of the insights that were gleaned from these breakout rooms. Janelle, Mariam, would you like to begin?
Yes, in our group, we discussed about the term used. It was about social distancing, and it was not appropriate for many cultures because many cultures depend on their families and relationships with friends. And also so it is physical distancing and not social distancing. As well to integrate the social determinants with this, the scientific approach and the political approach, because also depends on the culture they are addressing and the what is the message they are, spreading. There was also one issue, which is to use a team approach, and the public health also to be given and the social workers also to be given an important role to reach these people.
Yeah, to just briefly add on to that. So a lot of our conversation was around, as Miriam said, the sort of complexities of communicating public health to diverse audiences and publics. And that, like the physical and social distancing, that these one-size-fits-all solutions don't always fit the needs of local contexts. And so we had a lot of discussions about how to bridge those gaps between communities and researchers, not just with top-down approaches, but also like that sort of team attitude, bottom-up approaches that gain wisdom from local communities, and then bring in social science perspectives as well. And then finally, we talked about reframing the discussion in terms of trustworthiness and thinking about in different contexts, and particularly in fragile settings or in conflict situations, thinking about what information is needed, and then also who people are likely to listen to, right? Particularly in contexts where previous encounters with health professionals is limited, or no one's previously seen the benefits of science or the things that scientists do.
Great. Gabriel, would you like to add anything, or Marco? Gabriel or Marco?
I thought you were gonna go, Gabriel. I can see one thing that kind of stood out to me, which is the second part of the breakout room I was in. That is to say, we reflected on the way the exclusion of minoritarian or indigenous experiences of the world, epistemologies, formulations of problems, approaching questions, framing issues is really part of the problem, which to me, at least, even though we didn't get all the way there in the breakout room, to me, it kind of puts a lot of pressure on this, the characterization of global health, because it kind of makes you think of what do we mean, what globe is it when we say global health, which is a globe that is really made of confettis of exclusion. And it really does not cohere in a sense of shared community, which kind of speaks to a problem that emerged, I think, in both panels, namely that of making sure that different communities can have a voice and a part in the resolution of these issues.
Yeah, we also had sorry, Marco, I was stuck and I just couldn't unmute myself. We had a conversation about the moral values that are underlying those issues. And I think it's sort of another a layer or aspect to what you just said, but just in this so-called globalization, we stumble upon various local understandings of what is the global good, or what is true, what is good, what is just, and those understandings have to be taken into account before we start to decide who is more right or above whom. You know, like my understanding of justice is better than yours, and so it's really, I think, the participants who brought in various ways these questions really bring a good point to finish this day, I think, because it's you know, we started about trust in science and now we are into moral philosophy, which is not exactly a surprise. But then the question is, how do we tie those things together in a more creative and interesting ways, I think.
Maybe a good keyword for this would be, again, diplomacy.
Yeah, I see where you're going.
Perhaps. I just wanted to, as the session is approaching, I just wanted to just take a few moments to kind of recap some of the key takeaways from today's event. From our speakers in the moderated discussions and in the breakout rooms from members of the audience, we learned that, let me share actually. We learned that to address mistrust, it would be foolish to try to respond to this problem by just insisting that people who are distrustful or skeptical, that they're wrong and that they should simply just trust those in positions of power, be they doctors, public health officials, or scientists, or representatives of governing bodies. Rather, we need to learn about there are often very legitimate reasons for mistrust, and to respond to those directly if our goal is to rebuild trust with those who have lost it. We also have learned that the reasons for mistrust very often have to do with social and political values, and also histories of exclusion or even harm from the way that power is exerted. I think this is an important point to make because very often in the public health literature, you know, other reasons for mistrust that are commonly cited have to do with scientific illiteracy, you know, and I mean the spread of misinformation, which of course is a part that exacerbates mistrust. But what our speakers to discuss today was that really at the root of this problem has to do with social and political values, more so than with scientific, what counts as a scientific fact per se, as well as histories of exclusion that over time continue to breed or you know, enable mistrust to grow. We also heard from our speakers and from those in the audience when it comes to thinking about how to move forward. We need to think about what institutional changes need to be made to prevent the problem from growing moving forward. So whether that's training scientists, whether that's investing in systems that facilitate open science, transparency, interpretation, two-way dialogue. Those are some ways to facilitate institutional changes that could help to address the problem. A key theme was also, about this, a key theme was about trustworthiness. What makes an institution trustworthy to begin with? And just having more clarity on the answer to that question, knowing that, what can we do differently moving forward to rebuild trust? We also heard from a bunch of different speakers that there's a need to include insights from social scientists into global public health research and intervention. And I say social scientists broadly, so that can include, environmentalists, people from economics, sociologists, anthropologists, philosophers, but to include the insights from people who are not, public health practitioners primarily, but who do a lot of work to think about situating public health as a practice, thinking about situating science as a social and political process, and thinking about the intersections between science and society and policy. Also, what's not on this slide, what I'd like to add is also to include insights from people of the public, people who we do not necessarily consider scientists in a formal sense, but very often are committed to scientific fact seeking. It might be done in a different way, but that doesn't delegitimate what they can contribute to science-based decision making. And finally, we need to think holistically about this problem of mistrust. In this context, or the CUGH conference, of course, we were talking about it within the context of global public health. But as we've heard, the problem of mistrust transcends the public health sector alone. And if we are going to prepare for mistrust moving forward, whether it's another pandemic or it's an oil spill or something else, we need to think about this holistically, and several, especially in the breakout sessions offered, that we can do this by thinking about the problem through the lens of equity, which very often seems to be really at the root of trust and mistrust to begin with. On that note, I just again want to remind you that this event will continue on tomorrow at the same time, but it requires a separate registration. So if you registered for today's event, you can go return to that same website. I put the link there, but you need to register additionally for day 2 of this event. There will be a new set of speakers and a new set of topics, and we really, really hope you will join us. And I also just put my contact information there in case you would like to reach out to me, and I can communicate on behalf of the other organizers of this session to continue the conversation at a future date. Okay, on that note, I just again want to thank everyone in attendance for showing up today. Delighted for your presence and for your interactions. I learned a lot, and I hope to see you again tomorrow. Thank you.